Well, my father was a general practitioner here in Richmond. He went to the University of Richmond. He went to UVA Med School. He had work scholarships to pay for his education. He started out his practice in Louisa County and then later moved to Richmond and opened his practice on Grove Avenue. He was a staunch member of our church. He helped build cribs for the nursery. He was a deacon. My mom was his nurse. She graduated from Emory University School of Nursing and went to work in his practice until he got to a point where he could hire a nurse, and then she raised all of us. She served as a troop master for my Brownie troop. She was active in various women's clubs around the city, and I just really wanted to honor both of them by endowing a scholarship.
Being in the medical industry, obviously the Hippocratic Oath is first harm no others, and they both lived up to that very, very well. My mother was a very caring nurse. My father had a wonderful bedside manner. I run into patients even today that tell me about how wonderful he was as a physician.
My parents were pretty well known in the neighborhood and the community. The thing I remember a lot was that anybody that ever had an issue, my dad would go out and help them out. And he was a really kind person, as my mother was, and that's why, you know, all of the siblings we're all good people. We're all very, have a lot of empathy and integrity, and we got that from our parents.
One time at a basketball game at the arena when I was very small, I heard them call for a physician. They needed a physician. He didn't hear it, and I told him about it, and it turns out somebody had had a heart attack in the stands at the end of the game, and we spent all night in the emergency room at Richmond Memorial. My father brought the guy back to life. So that was his whole attitude, was caring about other people. And my mother was the same way, very nurturing person.
My father worked way too hard, but he just couldn't say no to anyone. I know that people that had financial troubles, he wouldn't charge them, or they would give him food instead of payments, and he would accept that. And unfortunately, he did pass away young at the age of 50. I was only 11 at the time, but my mother had to go back to work to support four of us and put us all through college, which she did. And that took a lot of work to retrain herself as a registered nurse. She went back to work at Stewart Circle Hospital and worked, till later in her life. And so, I would hope that the scholarship would be something that, if you remember the people or know a little bit about the people that this is in honor of, it's about working hard, being a good person, giving back to the community.
And when I set up that scholarship, when I first got the papers for it, it said that it was for a nursing scholarship. And I said, well, no, wait a minute. I've been on the Foundation Fund Board. I've seen where scholarships can be too limiting, and you don't have anybody that meets those requirements, then you can't award that scholarship. So I wanted it to be as broad as possible, so I said anything in the medical field.
The medical field is so diverse now. It's not just nurses and doctors. There are a lot of avenues that you can go into. Being a doctor or being a nurse, you have to give an awful lot of your time, energy, and yourself to be successful. And anybody who wants to do that, I say God bless them, and hopefully this commitment can help. But there's so many other areas of healthcare that are needed. We need people to go into different areas of research, manufacturing, development, all types of ways to help out in the healthcare industry. But the healthcare industry is a wonderful way to give back and to support your fellow mankind.
I think it's great to honor my parents with this scholarship and give someone the opportunity that they might not have had due to either financial circumstances or whatever the case may be.
The world of medicine is just totally changing. When you look at cancer treatment years ago and now, and they can direct it to a very specific cancer. When you look at all the research that's out there, you look at the fact that the vaccine for the virus was created very quickly and is very successful, you don't have to stick with one part of where you're going. There are so many different paths that you can go down.
We tend to forget the people that do the kind things, the good things. And I think that to honor people who do that sort of should inspire everybody to do the same thing.